Hello and good afternoon. Welcome to Facebook Live. This is Dr. Bill Bird. I'm the Chief Medical Officer at CGH Medical Center. Thanks for joining me this afternoon. We're going to follow our usual format. We're going to give you some facts. We're going to give you some news information about COVID-19. And what we've been doing lately is we're going to give you a little bonus information about some other medical related topics that we think will be of interest to those of you in the community and outside of the community. So with no further ado, let's get this kicked off. And Matt, as always, is going to put up some graphics for everyone to see. Thanks, Matt. So top left, those bars are cases in different months. So blue is August. Whatever color that is, let's call it orange, is September, and yellowish there is October. And you can see that's the delta time, right? So, Matt, okay. So that's the delta time, and you can, and the bottom left kind of is showing the same thing. So you can see that we had that surge in September, and we're starting to go down here in October. Pretty typical for what we see for these surges. And on the top right is last week versus the week prior to that. Red is last week, blue is the week prior to that, and the bottom right is red is the last 2 weeks, and blue was the 2 weeks prior to that. So once again, we're seeing, it's trending down, which is good. And next, for facts and graphics. So our positivity rate's 2.1%. I think the state positivity rate right now is about 2%, so we're pretty in line with that. And you can see on the right there, kind of once again, that up and down of the surge that we've had recently with this Delta wave. And then you can see like in April-ish that a wave that we had. And then if you go further to the left, we don't even go off the screen, but it went really high last November here in Whiteside County and the surrounding area. So any other graphics, Matt? I don't think so for today. Okay. I wanted to rattle off some numbers. Matt was telling me that we've been putting some Illinois Hospital Association numbers up every week, but if you have a phone, it's really hard to read them. So I'm just going to rattle them off. So rolling vaccines this past week jumped up to 58,000. And we were down, I think, to like 28,000 at one point in time. So this is obviously related to the booster shots that folks are getting. And I would anticipate that number will probably stay in that range or go higher. We'll see, with the addition of the 5 to 11-year-old shots, along with folks who are still interested in getting boosters. As of, I think yesterday, there were 1,278 people in hospitals in Illinois with COVID. 282 were in ICUs, 144 were on ventilators. Those numbers are trending downward. That's what we're seeing here at the hospital. There are still patients hospitalized with COVID, no question about it, but not as high as there were earlier this month and in September. And right now, 72.1% of Illinoisans above the age of 18 have been fully vaccinated. So more the merrier. All right, news. So just a few, more than a few that I want to share with you. So some CDC information. Did some studies on people who were vaccinated versus people who have some immunity from previous infection. And the vaccination folks had a 5 times greater response to that. Following up on that, some other vaccinated versus past infection people. This was in the Lancet ID journal, which Lancet is like the big scientific journal that comes out of the UK. So they found that it didn't matter whether you were vaccinated or had a past infection, how you spread and the tendency for you to spread COVID to the others in your household was essentially the same. In the households, those who were vaccinated, about 25% of them became infected, and about 38% of those who were unvaccinated got sick. What else? So Moderna is still, for right now, this Moderna immunization for 12 to 17-year-olds is still on hold. The FDA is still doing some more looking into that. And so that has to do with that 12 to 17-year-old group, in particular boys, making sure that the myocarditis concerns with that shot are not out, don't outweigh the benefits of that shot. I take that as a good thing. I mean, the FDA is being careful and doing their due diligence as far as that goes. I did want to clarify something that I guess I wasn't so aware of up until this past week. So Moderna, as far as the booster shot from Moderna, which has been approved. So if you're qualified for the booster shot and you're for whatever reason at enough of a risk that it's recommended, or you either may or you should get based upon the wording of those. So if you're in that bucket, like say a healthcare worker like me, I'm in that booster range where you would get half of a dose of a Moderna shot compared to what you got for the first or 2 doses. If, however, you are someone who has moderate to severe immunocompromised situation, in particular, like if you've had a solid organ transplant, you have a kidney transplant or a liver transplant, or you have an equivalent type of situation going on, then they recommend that you get a full dose of the immunization, kind of like you did for the first 2 shots. So anyhow, I just wanted to clarify that, and it just boils down to how your immune system is functioning. And I think at the time of their shot, I hope that gave you some guidance on that. Okay, what else? Yep, Carrie wanted to know about PEDS COVID vaccines coming, and Carrie, I do have some information on that. And I don't know, I think we might be able to put something up. Are we able to? Here you go. So this is here at CGH. They're going to be Fridays, November 5th, 12th, and 19th from 2:30 to 5. PEDS department. You can see the number to call to schedule an appointment. It's not going to be a walk-in situation. I don't know all the details. I think we're looking through to see if there are other offices that we would consider giving out pediatric shots at. And it's just so early on right now that we don't have any of that information. So I'm sure by this time next week, I'll have more information to share with you. I also saw that the health department is going to start giving shots, I think this Friday, and then they'll be doing Monday through Friday. It's also appointment only. And if I remember right, that is more of like an 8:30 to 5-ish kind of time frame. So yeah, the health department is going to be ramping up that as well. So yep, good question. That's the plan. I'm just going to skip down to this whole PEDS immunization 5 to 11-year-old thing. So more details about that. So the kids, the 5 to 11-year-old range, are going to get about a third of the dose of the shot that like adults get for a Pfizer shot. There's about 29 million children that would qualify for this. CDC ran the numbers, and based upon their epidemiologists who run these kind of numbers, ballpark, getting those kids vaccinated would result in 58,000 fewer cases. Would result in 58,000 fewer cases and 226 fewer hospitalizations per million doses for these kids. So for every million doses are given to that 5 to 11-year-old age range, that would reduce cases by 58,000 and hospitalizations by 226. And the numbers that they run would say that in getting these kids vaccinated, they anticipate from November 21st to March 22nd that we would be reducing the number of cases in the country by about 600,000. So that's all good stuff. That's why this has been, first of all, it's safe for kids. And second of all, it's approved because of all the ripple effects of getting these young ones immunized. So, yep, that is the deal on that. Okay. Yep, I'm sure they can, Pat, but it's a heck of a lot less likely, particularly nowadays if you throw the booster on top of that. because what the booster is going to do is it's going to jump up your antibody, the amount of antibodies you have circulating through your body, kind of help your body's natural immune system to help itself out. So yes, you can, a lot less likely. And Pat, to answer your question in more detail, I think it just was approved here in the last, 3 weeks, 4 weeks. So I know that the CDC will be doing, and others will be doing, studies on the number of folks who have had the booster shot, and we'll get a better sense of how effective it is in terms of decreasing your risk of getting sick as we go into the next few months. Okay. What else did I want to get that? I've got my checklist work. Oh, okay. For kids who are 11, should they wait until they are 12 to get the full vaccine? Good question. I think it's personal preference in terms of what you want to do in that situation. I don't think that there is a right or wrong answer. If it were my child, I think I just want to get the shot in them. So I think I just go for it, and unless they're really close to being 12. But once again, that would be a personal parental decision. Good question. All right. So for our COVID clinic, this is for whether you want to get your first or second shot, or you want to get a booster shot. And we still do that Monday through Friday at the main clinic on the second floor in our ear, nose, and throat department. We're asking, because of all the folks who are getting booster shots, it's been advertised as you can just walk in. I think there might even be a billboard up that says walk-ins welcome. Not right now. So for right now, please, if you want to do our Moderna, it's a Moderna booster clinic. If you want to do that, please make an appointment to have that done rather than just show up. It would be really helpful in terms of the flow of patients through that clinic. So wanted to let everyone know about that. So I saw an article in JAMA, and it was looking at patients who had a pretty significant reaction to their first mRNA dose. I don't know if it was Moderna or Pfizer, to be honest with you, I can't remember, but they had 159 patients who got that second dose. 30% of those were pre-medicated with antihistamine, but all tolerated it. And so for those folks who had a pretty significant reaction with their first immunization, it sure appears as though getting the second one is still a reasonable thing to do. I think if I were you and I were in that situation, though, I probably would do it in more of a healthcare setting than maybe just a retail pharmacy, just as a extra precaution. But yeah, I think that's looking good. Okay, another CDC information that's come out this week. So they compared folks who have either been vaccinated, fully vaccinated, or have had a previous infection. And for at least 6 months, both of those conferred very good protection in terms of getting a second infection. But over time, the vaccine did much better. It was much stronger in terms of its antibody response. So that's encouraging. And every one of those people that have that protection is a good thing. So do I support just waiting to get an infection? Absolutely not. Because if you do the math on that, unfortunately, around 1% of the people who get an infection die from it. And even though that's 1 in 100, when you have really big numbers, that ends up being a lot of people. And a higher percentage than that end up being hospitalized, which is not good either. So I wouldn't count. Please don't count on your previous infection. But if you have it, just know that window is around 6 months, it looks like right now. I will keep going. Oh, yeah. So today, the Biden administration now has come out and has said that January 4th is the date that folks need to have this mandated vaccine done. So as I was reading that news clip, it looks like on the private business side of things, for businesses with more than 100 employees, that's kind of falls under the OSHA bucket, that there's going to be a way for those businesses, the employees it looks like they're either going to have to be vaccinated or to be tested on a regular basis. So those folks are mandated to either test or to have a vaccine, from what I'm seeing so far. They also talk about government contractors. I didn't get into the weeds on that one. And at least right now, what I read about healthcare workers, they're saying that the vaccine would be mandatory for them. There's still some details to come out. I just saw a news flash. I'm sure we'll get more details soon. I obviously would not be surprised and anticipate that this will work its way through perhaps some court, not perhaps, it will work its way through some court cases before that January 4th deadline. But yeah, that is the latest information on that from the Biden administration. Okay, that's news. That's facts. That's news. I'm going to give you some bonus news because I'm just in a bonus news mood. And here goes. So this is not a good bonus piece of information in terms of positive stuff, but I'm going to say it. Adolescent screen time went up from 3.8 to 7.7 hours between 2016 and May of 2020. So for those adolescents watching, and for those who know adolescents who you might want to, just encourage on this item, boy, let's cut that back down to 3.8 hours. That sounds like plenty to me. So just let's keep that in mind, and we want people up and moving around, that's for sure. I'm gonna try to find a positive bonus thing. Okay, this is pretty positive. CDC has just come out and said for people who between the ages, basically less than 60, and mainly 30 to 59-year-olds, they're recommending that those adults get a hepatitis B vaccination series, because the progress on hepatitis B infections, which can cause significant liver disease, has stalled. So anyone born after 1991, that has become like the standard for kids to get immunized for that. But kind of before 1991, and then going back to, I can't do the math on that. Anyhow, 60 years and less, they're recommending get a hepatitis B series. If I remember right, it's a 3-shot series. I think you get one, then I get one like in a month or two, and then you get one in 6 months. Okay. Oh, I think this is a positive bonus. As a matter of fact, I know it's a positive bonus. So I can't remember who did this study, but they did a study. Someone did a study. About 5% of the people who are diagnosed with diabetes type 2, so adult onset diabetes, are actually able to go into remission for at least a year after that diagnosis. So in other words, their hemoglobin A1C, which is a long-term blood sugar test that we check people for diabetes type 2, goes below 6.5, even though initially it was higher than that. So I think the positive of that is that, yeah, if you're someone who finds out about that diagnosis and makes lifestyle changes, you start eating differently and healthier, and you exercise on a regular basis, you can turn back time. So just keep that in mind for those of you who are in that camp or know someone in that camp, that there is an opportunity there to turn back the clock and not have to take medications either. So I think that's good. Okay, now I started this last week, and I'm going to keep doing it for a while. I think I'm going to do some shout outs. So first shout out I want to give is, this is Infection Prevention Week. And that's been a big thing at a hospital. Well, it's always a big thing in a hospital. But for the last year and a half plus, it's been a real big thing at the hospital here, at every hospital. So Gina Superzinski and her team here at the hospital have done a bang-up job with all the things that have had to happen with this COVID situation in terms of infection prevention. So huge shout out to our infection prevention team. Okay. And matter of fact, I'm going to rattle off that team. So it's not just Gina. It's Liz Foster. It's Tyler Lawson. It's Angie Reitzel. Missing someone. Oh, and Linda, who does our cancer registry. So those are the folks. I hope I didn't forget anybody, but that's the team that does a lot of that work. And so a shout out to them. So thank you very much. And I want to give a big shout out to our auxiliary. This is their 75th anniversary for our auxiliary, our volunteers. Oh, and there they are right there if you want to find out a little bit more about that. Or hey, how about this? If you want to be part of the next 75 years, why don't you join the auxiliary? So reach out, and they do great work. They do. If you're around this hospital, you're going to see the folks in the navy blue smocks all over the place, really being helpful for our patients and our staff. So thank you so much to our auxiliary. When you drive by the hospital and you see the Christmas lights, which I can't remember, I think they're either started or they're going to happen real soon. That's thanks to the auxiliary. They have funded that for the hospital. So thank you to them for that as well. Another shout out I want to give is for our Daisy Award winner. So I think Matt might have a visual. This is Cindy Farger, and Cindy works in our Digestive Health Center, and Cindy does a great job down there. So the Daisy Award, I'm not going to go into detail, but I call it an award for excellence and caring and compassion in nursing. So shout out to Cindy for receiving that award here at CGH. And then finally, for shout outs, we had a couple of longtime employees who retired last week, and I just wanted to say thank you to them. So the first one I'm going to mention is Julia Hammer. Julia is a social worker and worked in our social services department for 31 years. So my hats off, shout out. Thank you, Julia, so much for all your work here at CGH. We are definitely going to miss you. And the second shout out is for Penny Carl. Penny has worked for 35 years in our DID, which is our X-ray. There we go, in our X-ray department. So Penny started out as an X-ray tech, spent a lot of years as an MRI technician, and then actually spent a little time doing reception work because she wasn't quite ready to fully retire. But now she is. So I wish her nothing but the best in retirement as well. So shout out to Penny and to Julia. Okay. And then I'm going to end with just a few thoughts, opinion, if you will. So if you humor me, I would just ask that those who are listening to just continue to do your part. Get your flu shot. It's time to do that now. Get your booster if you're able, if you fit into one of those categories. If you haven't been vaccinated yet, go for it. Get vaccinated. Millions and millions, I think billions of people have been vaccinated, and it's working out really well in terms of any side effects for those folks, and it's really helpful for our community to have as many people as possible vaccinated. So get vaccinated. If you have a 5 to 11-year-old, go ahead and please get them vaccinated as soon as you can. You know, if you're indoors in a public setting, if you're not eating, obviously if you're eating, that's not going to work so well. But otherwise, if you're indoors in a public situation, keep a mask on. Keep a mask on. Because we're still seeing relatively healthy community members show up here at the hospital and need to be hospitalized and get really sick. So yeah, keep wearing that mask indoors. But after that, after you do your part, enjoy life. Go about just enjoy things and do the things you like to do within, just do those parameters, and then otherwise enjoy life. So that's what I would end on. Marianne, Julia was so wonderful helping. Julia, thank you, Marianne. I couldn't agree more. There have been a lot of husbands and a lot of wives and a lot of grandmas and grandpas that Julia and Penny were so helpful for during their time here at CGH. So until next week, until next time, which will be next week, have a healthy and safe week, and thanks for watching.